Have you ever looked at your insurance after being told that you need hearing aids and thought, wait a minute, they'll help pay for a knee replacement, a pacemaker, even a CPAP machine, but not my hearing aids? If you've ever wondered why, you're definitely not alone. And believe it or not, the answer starts over 60 years ago. Hi, I'm Chuck Smith, owner of Affordable Hearing with locations in Rochester, Logansport, and Lafayette, Indiana. And this is probably one of the most common questions that we hear from patients. They'll sit down in our office after we've completed their hearing evaluation, and they'll say, I don't understand. My insurance covers doctor's visits, it covers surgeries. So why won't it cover the hearing aids that I actually need? And it's a fair question. Honestly, most people assume insurance companies simply decided hearing aids weren't important enough to pay for. But that's actually not where the story begins. The story begins back in 1965 when Medicare was just created. At that time, lawmakers had to decide what Medicare would and wouldn't cover. Hospitals? Yes. Physician services? Yep. Many medically necessary treatments? Absolutely. But hearing aids? They were specifically left out. Why? Because back then, hearing loss was viewed very differently than it is today. It wasn't considered a medical condition that deserved treatment. Instead, many people, including policymakers, looked at hearing loss as simply another part of getting older, kind of like getting wrinkles or gray hair. The thinking was, it's unfortunate, but it's just a part of aging. Today, we know that's simply not true. We know untreated hearing loss can affect conversations with your spouse, relationships with your children and grandchildren, your confidence at work, your safety, and even your overall health. But in 1965, none of that research existed. So Medicare excluded hearing aids. And here's the part most people never hear. That decision didn't just affect Medicare patients. It actually helped shape the way much of the insurance industry looked at hearing care for decades afterwards. One decision made over 60 years ago is still influencing what millions of Americans pay out of pocket today. Tomorrow, I'm going to explain why one government decision ended up influencing private insurance companies, even though they aren't required to follow Medicare's rules. Before you scroll, let me ask you something. Were you surprised to learn this all started back in 1965? Tell me in the comments and follow along, because part 2 might surprise you even more.